Medicare Part D, okay? We're gonna talk about Medicare prescriptions here. Medicare Part D has changed a lot from 2024 to 2025. It's gotten a lot better. Again, Medicare Part D is the prescription drug coverage offered by Medicare. There's private plans, either through a standalone plan or through a Medicare Advantage plan. These plan premiums are subject to IRMA, just like your Part B premium is. I'm gonna show this chart here in a minute that will go over what the premiums are if your income is above a certain amount. Plans are going to have monthly premiums. They're also going to have formularies. Typically, those formularies are going to have tiers 1 through 5. Tier 1 being the least expensive medication, tier 5 being a specialty medication. Okay, plans are going to have a deductible, an initial coverage level up to a catastrophic level. In 2025, the maximum deductible a Part D plan can have is $590. Now, most plans waive that deductible for generic medications, and you just have to pay that deductible for brand name medications. In the initial coverage stage, you're either gonna pay a copay or a co-insurance amount for your medication after that deductible. All those costs that you pay are gonna go contribute towards you reaching the catastrophic level, which is once you reach $2,000 in out-of-pocket cost, all of your medications are covered 100%. Now, this is brand new for 2025. Prior to 2025, there was no max out-of-pocket on your medication exposure. So this is a game changer. Now, we have seen the effects of this do some very good things as well as some negative things. You know, that out-of-pocket maximum is huge for people when it comes to budgeting their medications costs, specifically if you have very high medication costs. Okay, we have seen carriers, because they're taking on such a huge financial risk, they have tightened up formularies. They've made more expensive medications harder to get covered. So you need to really look at these plans and make sure your medications are covered. Again, this is something that my team as well as myself are going to break down for you. We're gonna make sure that all your medications are covered. Make sure you have to jump through the least amount of hoops to get those medications covered. Okay, it's a full breakdown. In addition to your plan, we gotta make sure your medications are covered as well. So in addition to the $2,000 max that was part of the Inflation Reduction Act, in 2025, there's a program called the MPPP. Now, what this plan does, allows you to spread the cost of your medication cost over all 12 months. If your medication costs are going to be over $600 for the year, you can spread that cost across the year to budget. Okay, so you might incur that $2,000 maximum in the first quarter of the year. Instead of having to pay that all up front, you can tell whatever Rx carrier you choose that you want to spread that across 12 months. They will send you an invoice every month for those medications to help you budget for it. Now, Part D plans are subject to a late enrollment penalty if you don't enroll in one in a timely fashion. Just like enrolling Medicare, you need to do it 3 months prior, the month of, or 3 months after your 65th birth month. Now, or when your Part B starts. Now, a lot of people who aren't taking any medications say, Tim, why do I need to enroll in a Part D plan? Well, again, my expertise and my advice would be enroll in the RX plan. There are some very affordable options. We don't know what's gonna happen tomorrow. We need that protection. We can get you a plan that's very low cost to cover those medications. And then if we need to adjust that plan each year and moving forward, me or my team will do so.